Hello everyone and welcome to Colorful Twilight. Today, we're diving deep into a topic that could truly transform the lives of seniors aged 5 and older. The life-saving importance of regular health checkups. Whether you're listening for yourself, a parent, a grandparent, or a friend, this discussion will arm you with the knowledge to make informed decisions about health in the golden years. Let's start with a sobering fact. Nearly 80% of chronic illnesses affecting seniors like heart disease, diabetes, and certain cancers can be prevented or better managed with early detection. Yet studies show that over 30% of seniors skip their annual checkups. Why does this happen? And how can we reverse this trend? Let's explore. Aging is a natural process, but it brings changes that make our bodies more vulnerable. Organs slow down, metabolism shifts, and the immune system weakens. Many age-related conditions, such as high blood pressure or osteoporosis, develop silently. You might feel perfectly fine, but beneath the surface, something could be going wrong. For example, hypertension, often called the silent killer, rarely shows symptoms until it triggers a stroke or heart attack. Similarly, Type 2 diabetes can quietly damage nerves and blood vessels for years, before causing noticeable problems. This is why relying on how you feel isn't enough. Regular checkups act like a radar, detecting hidden dangers long before they escalate. Let's talk about cognitive health. Memory lapses or occasional forgetfulness are often brushed off as normal aging, but they could signal early-stage dementia or Alzheimer's. Neurologists emphasize that early intervention through medications, lifestyle changes, or cognitive therapy can slow progression and improve quality of life. A simple 10-minute memory test during a routine doctor's visit might uncover issues that, if addressed early, could preserve independence for years. Cancer is another critical area. Seniors are at higher risk for cancers like colorectal, breast, and prostate. Take colorectal cancer. It often starts as small polyps in the colon, which can be painlessly removed during a colonoscopy before they turn cancerous. Yet many avoid this procedure due to fear or discomfort. The truth? Modern sedation techniques make colonoscopies far easier than most imagine. For breast cancer, mammograms remain the gold standard for early detection. Even if you've had normal results for years, continuing screenings is vital. Risk increases with age. Medication management is equally crucial. The average senior takes 4 or 5 prescription drugs daily, sometimes more. Over time, these medications can interact in harmful ways or become less effective as the body changes. For instance, a blood thinner that worked well at 65 might cause dangerous bleeding at 75. Regular checkups allow doctors to review and adjust dosages, ensuring treatments remain safe and effective. Now let's break down the essential checkups every senior should prioritize. First, comprehensive blood tests. These aren't just about cholesterol and blood sugar. A basic metabolic panel checks kidney function, electrolytes, and liver enzymes, vitals for spotting issues like kidney disease or dehydration. A complete blood count, CBC, can detect anemia or infections. Thyroid tests are also key, as an underactive thyroid common in seniors can mimic depression or fatigue. Blood pressure monitoring should be non-negotiable. Even if you check it at home, clinic readings are more accurate. Hypertension damages blood vessels over time, leading strokes or kidney failure. If your numbers creep above 130/80, lifestyle changes or medication can prevent irreversible harm. Cancer screenings need a dedicated focus. For colon cancer, colonoscopies every 10 years, or 5 if polyps are found, are recommended. Stool-based tests like FIT-A can be done annually for those who can't undergo colonoscopy. Women should continue yearly mammograms until 75 and discuss risks-benefits with their doctor afterward. Men over 65 should have a prostate-specific antigen, PSA, test, especially if there's a family history. Skin checks for melanoma are also critical. Seniors who spent years in the sun are at higher risk. Bone health is often overlooked. Osteoporosis affects 1 in 4 women over 65, increasing fracture risks. A DEXA scan measures bone density and is recommended every 2 years. If detected early, treatments like bisphosphonates or weight-bearing exercises can strengthen bones. Vision and hearing exams are about more than just glasses or hearing aids. Glaucoma, a leading cause of blindness, has no early symptoms. Annual eye pressure checks can catch it early. Hearing loss, meanwhile, isn't just an inconvenience, it's linked to social isolation and dementia. Simple audiometry tests can determine if hearing aids are needed. Vaccinations aren't just for kids. Seniors need updated shots to protect against pneumonia, shingles, which can cause debilitating nerve pain, and annual flu vaccines. COVID-19 boosters are also essential, as older adults are more vulnerable to severe outcomes. Mental health checks should be part of every senior's routine. Depression and anxiety are common but underdiagnosed in older adults. A doctor might use questionnaires like the geriatric depression scale to screen for these issues. Cognitive assessments such as the mini mental state exam, MMSE, help track memory and reasoning skills over time. Now let's address the barriers that keep seniors from these checkups. Fear is a major one. Fear of bad news, painful tests, or losing independence. But here's the reality. Early detection gives you more control. For example, catching prediabetes lets you reverse it with diet changes, avoiding insulin dependence later. Cost is another hurdle. Many seniors worry about medical bills, but programs exist to help. In the U.S., Medicare covers most preventive services at no cost. Community health centers often offer sliding scale fees. Nonprofits like the American Cancer Society provide free screenings for low-income individuals. Mobility challenges can make clinic visits tough. Solutions include telehealth consultations for follow-ups, mobile clinics that visit senior centers, or home health services. Family support is invaluable here. A loved one can drive you to appointments or help organize medical records. Transportation is a hidden barrier. Many seniors no longer drive, and public transit might be inaccessible. Ride-sharing services like Lyft or Uber Medical offer discounted rides for medical visits. Local senior centers sometimes provide free shuttle services. Let's not forget cultural or language barriers. Non-English-speaking seniors might avoid checkups due to communication fears. Many clinics now have interpreters or multilingual staff. Advocacy groups can help navigate these challenges. To those who say, "I'm too old for this," consider this. Your golden years should be about joy, not avoidable health struggles. Imagine being able to play with grandchildren, travel, or garden without pain. Regular checkups protect that freedom. Nutrition and exercise play supporting roles. A diet rich in vegetables, lean proteins, and whole grains supports overall health. Strength training preserves muscle mass, reducing fall risks. Even gentle activities like walking or Tai Chi improve balance and mood. Caregivers and family members, this message is for you too. Encourage the seniors in your life to prioritize checkups. Offer to join them. It eases anxiety and ensures they follow through. Keep a shared calendar for appointments and medication refills. Technology can help. Apps like MediSafe send pill reminders. Smartwatches monitor heart rate and activity levels. Online patient portals let you view test results and message doctors without leaving home. In closing, think of your body as a lifelong home. Just as you'd maintain a house to prevent leaks or cracks, regular health checkups preserve your body's foundation. Don't wait for a crisis. Empower yourself with prevention. Schedule that overdue checkup today. And if you know a senior who's been avoiding the doctor, share this message. Together we can ensure that aging isn't about surviving but thriving. Thank you for listening. If you found this helpful, please subscribe and share it with someone you care about. Your health is your greatest wealth. Nurture it. Until next time, stay well.